like Dr. Nanavati said, I'm one of the colorectal surgeons. My name's Christina Go. I moved to Syracuse in 2020, and I've been here as a colorectal surgeon since then. Well, it's hard to believe that March is finally here, but it is, and that is Colorectal Cancer Awareness Month. So in the United States, colorectal cancer is the third leading cause of cancer-related deaths among men and women. And what's even more striking is that among younger patients that are basically between 20 to 49, this is rising. So by the year of 2030, it's projected that this will be the leading cause of cancer among young people. Some individuals learn about their colon cancer diagnosis because they have symptoms. And the most common symptoms that you might have are blood in your stool, belly pain, unexplained weight loss, fatigue. And those patients really need to be counseled to get some kind of diagnostic testing, as in a test to figure out what's going on. That's very different from what we consider screening, as in doing a test without symptoms to see if there's anything underlying. And about a third of my patients come in with a screening test that found a colon cancer. So what types of screening are out there and available? The simplest test is a stool-based study, and that's where we're trying to detect blood or what we call circulating tumor DNA within your stool. And that can escalate to a more intense study, which I'm sure you've heard about, like a flexible sigmoidoscopy or a colonoscopy, with the dreaded bowel prep before that. That being said, I cannot reinforce how important screening colonoscopies are. So you might be asking to yourself, well, who should get screened? When do I get started on my screening? And what does that involve? So for a patient who has normal risk factors, as in they don't have a family history of polyps or colon cancer screening, we now recommend that you get a screening test at age 45. And that's a little bit newer of a recommendation. When I started training, it used to be at age 50 that you would start that. And like I said, we can start with stool-based, and if that is a positive result, you might need to be counseled on getting a colonoscopy as a follow-up. So for patients who have higher risk factors, as in they have a first-degree family member, that means parents, siblings, children with either colon cancer or polyps, they may need to start earlier than the age 45. Generally, what I recommend is you go by the relative who is the youngest and subtract by 10 years. So if you had a family member at age 40 be diagnosed with colon cancer, you should start your screening at 30. And then the frequency of any kind of follow-up depends on what is found and basically when that family member was diagnosed, whether it's older or younger. In addition to screening, a lot of my patients ask, well, what can I do about my colon and digestive health to help prevent this? A lot of the times they're asking if they had done anything wrong. Honestly, it's a lot of just bad luck and genetics that we might not know all of the genetic factors going in there. But here today, we also have ways to change your diet, and this is why everybody's here to learn more about it, that can help with your overall colon health, whether it's diseases that have to do with the colon not related to cancer and ones that are related to cancer. So there's no magic pill that can prevent you from getting colon cancer or polyps, but things such as regular exercise, having a diet based in fruits, vegetable, fiber, and trying to avoid red meats or processed foods can help decrease the inflammation in your colon and also promote what we call the good bacteria in your colon that you often hear about in food commercials in the grocery store or otherwise. And I think that's really great that everybody's here trying to get healthier. So I've read somewhere that colorectal cancer doesn't wait, so neither should we. This sounds really ominous with all of these statistics that I threw at you earlier in talking. But in my opinion, I think this is actually very optimistic. The reason that I chose colorectal cancer, in addition to jokes about passing gas, is because colorectal cancer is very treatable and often curable or preventable. So being here right now talking about regular screenings, early detection, and informed choices can let you know that colon cancer and rectal cancer can often be prevented or successfully treated with a cure. And like I said, this is one of the many reasons that I decided to go into colorectal surgery. The other thing is in the back, Rachel, she'll wave, has some fit kits. This is a stool-based sample in terms of wanting to get a colon cancer screening, and it's pretty straightforward. And based on that, if it's negative, you just need to get another test in a year. If it's positive, then we would start by referring you back to your primary to figure out what the next steps are.